Indications. What is Pegasus? Pegasus, PEG interferon alpha 2A, is a prescription medication that is used alone or with Copegas, ribavirin USP, to treat adults and children 5 years and older who have chronic, lasting a long time hepatitis C infection and certain types of liver problems and have not taken alpha interferon. Used if you have chronic hepatitis C. You should not take Pegasus by itself unless you are not able to take Copegas. Used to treat adults with chronic hepatitis B virus who show signs that the virus is damaging the liver. It is not known if Pegasus is safe and will work in children under 5 years of age. Important safety information. Boxed warnings. Pegasus, like other alpha interferons, may cause or worsen fatal or life-threatening problems like mental, immune system, heart, liver, lung, intestinal, and infections. Your doctor should monitor you during regular visits. If you show signs or symptoms of these conditions, your doctor may stop your medication. In many patients, but not all, these conditions get better after they stop taking Pegasus. See the medication guide for more information and warnings. Ribavirin, including Copegas, can cause birth defects and/or death to an unborn baby. Female patients and the female partners of male patients should avoid getting pregnant. Ribavirin is known to cause anemia, low red blood cells, which can make heart disease worse. See the Copegas medication guide for more information and warnings.
Pegasus is supplied in a pre-filled syringe, or PFS. This syringe is designed to make your injection as easy a process as possible. Because the syringe is pre-filled, there's no need for you to measure out your own dose. Also, the medication in the syringe stays in your body for a long time, so you only need to take it once a week. Because you'll be giving yourself Pegasus injections at home, it's essential that you know how to store the medication and inject it correctly. You might want to refer to this chapter for a refresher now and then, or use it to train anybody else who may help you with your medication. If any questions come up, never hesitate to talk with your healthcare team. Roche, the maker of Pegasus, also provides another number, 1-877-PEGASUS, or 1-877-734-2797, which allows you to speak with a nurse. Before you inject, remember, Pegasus must be kept in the refrigerator, but it should never be frozen. Avoid exposing it to direct sunlight. To avoid product foaming, do not shake the pre-filled syringes of Pegasus. Choose a clean, comfortable area to give yourself the injection, and make sure all the supplies you need are close at hand. This way, when it's time to give yourself the injection, you'll have one Pegasus pre-filled syringe, one needle with needle guard, a puncture-resistant sharps container, and an alcohol pad. To inject Pegasus, take the syringe out of the refrigerator. If there is foam in the solution, put it back in the refrigerator for use at a later time and use another syringe. Lay the syringe on a flat, clean surface and wait a few minutes until it reaches room temperature. If you notice condensation on the outside of the syringe, wait another few minutes until it disappears. Wash your hands with soap and warm water to prevent infection. After the syringe is warmed up, pick it up by the glass barrel and look at it carefully. Do not use Pegasus if the medicine is cloudy, the medicine has particles floating in it, the medicine is any color besides colorless to light yellow, or the expiration date has passed. Attach the needle to the syringe. First, remove the needle from the package, but leave the needle shield on. You should never let the bare tip of the needle touch any surface. Remove and throw away the rubber tip on the syringe. Hold the needle close to the hub where the green needle cover connects. Put the needle on the end of the syringe using an easy twisting motion to tighten the needle onto the syringe. Decide where to self-inject. Pick a place on your stomach or thigh. Avoid your navel or waistline. Pick a different spot each time you give yourself an injection. Then clean the area with an alcohol pad. Let the skin dry for about 10 seconds. Prepare the syringe for injection. Uncover the needle by removing the plastic cap from the shield. Pull the green needle cover back from the needle toward the syringe barrel. The needle cover will remain in the position you set. Do not remove it. It is a safety device designed to prevent you and others from accidental needle sticks. Hold firmly where the needle attaches to the syringe, the hub. Be sure not to touch the sterile part of the needle. Remove the clear plastic needle shield covering the needle by pulling it straight off. Remove air bubbles from the syringe by holding the syringe with the needle pointing toward the ceiling. If you see little bubbles, pull down slightly on the plunger rod. Using your thumb and finger, gently tap the syringe to bring air bubbles to the top. Small air bubbles may remain on the glass surface. Press the plunger in slightly to push the air bubbles out of the syringe. If you find that there are still small air bubbles on the glass surface after you push the air bubbles out, you can still give yourself the injection. The small air bubbles will not hurt you. Depending on the dosage your doctor has prescribed, you may have to drain off some of the medicine before you inject. The syringe has markings for 180 micrograms, 135 micrograms, and 90 micrograms. Your doctor will tell you which mark to use. Slowly and carefully press on the red plunger rod of the syringe to push out the excess medicine. Keep pressing until the edge of the plunger stopper reaches the correct mark on the side of the syringe. Do not decrease or increase your dose unless your doctor tells you to. Do not save or reuse any medication discharged from the syringe. Perform your self-injection. Position the point of the needle so it's facing up. Pinch a fold of skin on your stomach or thigh firmly with your thumb and forefinger. Hold the syringe like a pencil at a 45 to 90 degree angle over your skin, and in a quick motion, insert the needle as far as it will go into the pinched areas of the skin. Pull back the plunger very slightly. If blood comes into the syringe, the needle has entered a blood vessel. Do not inject in that case. Withdraw the needle and discard the syringe as you will be shown in a moment. Then repeat the self-injection steps with a new syringe. If no blood appears when you pull the plunger back, however, release your skin and slowly push the plunger all the way down so that you get all your medicine. Pull out the needle at the same angle you inserted it. Wipe the skin area clean with an alcohol pad. Cleaning up. Before you throw out the syringe and needle, push the green needle cover toward the needle. Then place the free end of the green needle cover on a flat surface and push down on it until it clicks and covers the needle. Always place used needles and syringes in the sharps container immediately after use, and never reuse them. Never tamper with the green needle cover after it has been engaged.
What is the most important information I should know about Pegasus? Copegas in combination with Pegasus may cause birth defects or death of your unborn baby. Pegasus therapy may cause you to develop mood or behavioral problems. Some people who take Pegasus alone or in combination with Copegas may get heart problems, stroke, or symptoms of a stroke. Some people taking Pegasus develop new or worsening autoimmune problems. Some people who take Pegasus may get an infection. Pegasus alone or in combination with Copegas can cause serious side effects. Some of these side effects may cause death. Tell your healthcare provider right away if you have any of these symptoms while taking Pegasus. Do not take Pegasus if you have certain other liver problems, have certain types of hepatitis caused by your immune system attacking your liver, autoimmune hepatitis, have had a serious allergic reaction to another alpha interferon medicine, or to any of the ingredients in Pegasus. Do not take Pegasus in combination with Copegas if you are pregnant or planning to get pregnant during treatment or during the 6 months after treatment, are a male patient with a female sexual partner who is pregnant or plans to become pregnant at any time while you're being treated with Copegas or during the 6 months after your treatment has ended, have certain blood disorders such as thalassemia major or sickle cell anemia. Take didanosine, Videx or Videx-EC. Do not give Pegasus to a baby under 1 year of age. Pegasus contains benzyl alcohol. Before taking Pegasus, tell your healthcare provider about all your medical conditions or problems, and if you are pregnant or breastfeeding, or plan to become pregnant or breastfeed during treatment with Pegasus. Tell your healthcare provider about all the prescription and non-prescription medicines, vitamins, and herbal supplements you take. Pegasus can cause serious side effects including blood problems, thyroid problems, blood sugar problems, serious eye problems, serious liver problems, worsening of liver problems including liver failure and death, lung problems, inflammation of your pancreas, inflammation of your intestines, serious allergic reactions and skin reactions, effect on growth in children, and nerve problems. The most common but less serious side effects of Pegasus include flu-like symptoms, tiredness and weakness, stomach problems, loss of appetite, skin reactions, hair thinning, trouble sleeping. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. Please see Pegasus full prescribing information and medication guide, including boxed warnings, for additional important safety information.